Hello, and welcome to today's Rate Fast Speed seminar, Medical History Taking. I'm Dr. John Alchemy. Today we're going to be discussing the important elements of medical history taking, be it a qualified medical exam, an agreed medical examination, or a primary treater's PR4 report. First of all, let's talk about what a medical history is. A medical history is a synopsis of how someone was hurt or injured given the past circumstances of their injury or illness and how it has contributed or led the injured worker to their present state of health. In reports where causation is in play, such as a qualified medical exam, an agreed medical exam, or a doctor's first report, the medical history is exceedingly important because it sets the stage and the circumstances of the injury. From there, the provider has to develop the chart to make logical descriptions and connections between how the initial injury occurred and how it is relevant to the patient's present complaints and physical exam objective findings. Ideally, the information of the medical history is obtained from the patient and in the patient's own words. The patient should lead the evaluator through the sequence of the injury, responses to the injury, their perspective on the treatment, and the benefit of the treatment. Remember, the medical history is the patient's opportunity to tell their story. The actual medical opinions on the medical probability is reserved for the provider to write in the causation section. The medical provider's role is to ask supporting questions and additional questions for clarification as the patient unrolls the history. Patients commonly complain that the doctor constantly interrupts them as they're trying to tell the story. A seasoned examiner will refrain from this activity and will make notes to ask when the patient is done speaking. This will serve two purposes. First, the patient will feel listened to and that they were able to tell their entire story to the evaluator. Secondly, it allows the evaluator to understand if there are any internal inconsistencies in the patient's history. Supportive questions from the examiner, such as, "What type of medication did you take?" or "How many of the pills did you take each time you treated yourself for pain?" conveys to the patient that the provider is engaged and interested in learning exactly what happened. Letting the patient drive the order of the events in the history is also important because it allows the provider to understand what emphasis and event values the patient believes are important. Now let's talk about our section which we call Nerd Knowledge. The description of the injury needs to be accessible to all readers. What does this mean? It means use plain and simple language that everyone can understand. Avoid medical jargon or overly detailed anatomic references when describing an injury and talking about the history. It may be appropriate sometimes to put exact quotes into the report so that the reader understands the language and the style that the patient is conveying their condition. For example, a provider may write, open quote, "The pain felt like I was going to pass out," close quote. Adding these types of details in a report also shows that the provider was actively listening. When the patient also reads a copy of the transcript, it is going to be very clear that the provider was taking detailed notes. Next, a good provider will read as many AME, QME, or PR4 reports as possible. Why is this of value? The art of history taking is an acquired skill, so the more you can review how others do it, the more quickly you can become adept and skilled in the process. Skilled examiners will also have a template that they will follow so they do not forget important elements of the history taking or get overly distracted or involved in the patient's descriptions. it's my recommendation to save the best report so you can always refer back to see a style and an element to history taking that you think is particularly compelling. Don't forget to read depositions as well. Attorneys can be skilled historians and ask very interesting and probing questions during depositions of both patients and physicians. Finally, when drafting the final history, be sure that it is written from the employee's point of view with the main points outlined. The report can be both thorough but yet entertaining to keep it readable and always moving forward with the plot. What happened? What kind of treatment was obtained? What was the result? What happened next? A great history will be short, to the point, and leave the reader satisfied and ready to move on to the next section of the report. So now it's time for our problem-solving segment of the seminar. Here's the situation. A patient presents for a brief medical history that doesn't really account for all the complications and symptoms of the case. Question: what are the questions that the medical provider should ask to try to get a more full and accurate picture? Number 1, try staying silent. Let silence be the friend of the interviewer. When the patient is done speaking, pause, and then ask them if there's anything else that's important or anything else that you should know. Number 2, when the patient has completed their story and feels that they have said everything that is important to them, then it's time to start asking some guiding questions. How did this experience of the injury make the injured worker feel? For instance, did they blame themselves? Did they blame a coworker? Or do they blame the employee for perhaps a broken piece of equipment that they feel they communicated in advance many weeks before the injury, however, were subsequently injured despite their best efforts to try to get the situation fixed? Finally, what are their expectations? Do they expect to be restored 100% to their pre-injury condition? Are they angry because they have not felt that they've received all the appropriate treatment and recommendation that their doctor has recommended? Or are they feeling helpless and overwhelmed with the complexities of the workers' compensation system? Thank you for joining us for today's Rate Fast Speed Seminar, Medical History Taking. This has been Dr. John Alchemy. Please learn more and come over to our website at rate-fast.com and click on the blog to learn more about California workers' compensation.